I'm Rasesh Desai. I'm Assistant Professor of Orthopedics at University of Kentucky Orthopedics and Sports Medicine Department. And as a part of UK faculty, I work at Medical Center Bowling Green, providing variety of orthopedic services here. I have three different specialties. I'm fellowship trained in joint replacement surgery. I'm fellowship trained in spine surgery. At the same time, I'm fellowship trained in pediatric orthopedic surgery. So I can see patients from all age groups, right from newborn to almost up to no limit. And it gives me the ability to treat the patient from all age group. I'm in a unique position because of my variety of fellowship training. I'm fellowship trained in spine surgery and joint replacement surgery. It gives me an opportunity to see the patient as a whole. Sometimes the patient comes to your office with a leg pain, hip pain, knee pain, and you find out that their actual problem is coming from the spine. Or it may be vice versa. Sometimes patients come with the back problems, but we find out the back problem is mainly because of the result of the hip and knee arthritis, and the way they are walking, it throws them off from the balance. So being a spine surgeon and joint replacement surgeon, it allows me to see the patient as a whole, diagnose the exact pain where it is coming from, and treat those conditions even without sending the patient to a different specialty. So University of Kentucky Orthopedic Department got into an agreement with Bowling Green Medical Center to provide the orthopedic service. The main purpose of this affiliation is to provide the same level of care which you otherwise would get at the bigger hospital in a rural community. Many times when the patients are in the suburban or rural communities, they are hesitant to travel to the bigger hospitals and bigger cities, but they still want the same level of care. And the whole purpose is to provide that facility, that specialty care right at the footstep so that they don't have to travel a long distance to go to the tertiary hospital. We can provide the same amount of care and same level of care right here at the community level rather than having the people sent to the bigger hospital. But even if they need something that needs to be taken care of the bigger hospital, being a part of the UK orthopedic department, it gives us ability to set them up with the right doctor and get the problem fixed. Whenever we treat the patient, especially if they are going to need any surgical treatment, I always encourage them to come with their family members. Surgery is not only about the patient, it involves the family members too. They also need to be participating in the care of that patient. So it is very important to keep them informed even before the surgery about what the surgery is about, what they can expect, when they can expect the patient to get back on their feet. So it is very important to involve the whole family together in the decision-making process and also to make them understand about the rehabilitation protocol. I think that helps a lot and goes a long way in patient's recovery. The favorite thing about my profession is to get the patient out of pain. When they come to us with severe pain, their life is debilitated because of the pain, you treat them, you get them out of the pain, and they move on with their life. When they come back in the clinic and tell me, "Doc, my pain is gone," and if they have broken bone, after treating them, you see them walking again, the satisfaction that you get, I can tell you, no money can buy it. And that made me inspired to go into this field.